Question will go
Thank
to
you.
Mr. Davies.
Mr. Speaker, Canadians are appalled by the disgraceful treatment of seniors in care homes across this country. Old folks are being left in soiled clothing, going without baths for weeks, and packed 4 to a room in dangerously unhealthy conditions. The situation is so bad that the armed forces have had to be called in to intervene. To the Minister of Health, is her government prepared to take strong action to address this crisis in seniors' health care?
The Honourable Minister.
Well, thank you, Mr. Speaker. And I think the member has illustrated some of the horror stories that have appalled us all as Canadians and certainly as parliamentarians. We know that seniors deserve to live in dignity and safety with the utmost care, and that just hasn't been happening in this time of COVID, but certainly in some cases in previous time as well. So as the member knows, I've said publicly that I believe that we need to hold long-term care homes to stronger standards. I have begun those preliminary conversations with my counterparts. I'm working with many ministers across our government to think about how we do that,
to Mr.
including
Davies.
the Minister of Seniors.
Mr. Speaker, if we treated children the way we do seniors in this country, social services would seize them. Over 80% of the deaths in Canada from COVID-19 have occurred in long-term care homes. Canada has the highest proportion of deaths in long-term care settings among 14 comparable countries, including France, Germany, Denmark, and Ireland. Canadians want action. What specifically is the minister going to do about the crisis in long-term care?
The Honourable Minister.
Well, I think the member opposite knows that long-term care homes have rested largely in the jurisdiction of provincial governments and, in fact, municipal governments who often run them and fund them partially as well. That's why it's important that we have those conversations with our provincial and territorial partners. But the member can rest assured this is on the top of my priority list to engage with my colleagues all across the country, including many experts who have studied this issue multiple times to come up with stronger standards so that all seniors have quality of life and safety and dignity in their elder years.
Mr. Davies.
Mr. Speaker, Canadians don't want politicians pointing fingers at each other. They want our seniors taken care of. COVID-19 didn't cause the problems, it exposed them. Decades of neglect by governments at all levels have resulted in this calamity. Not a single province or territory in Canada is meeting the minimum standards of hands-on care for seniors. And death rates from COVID-19 in private, for-profit facilities are 2 to 3 times that of public or nonprofit homes. Will the minister agree with New Democrats that we need strong national standards, federal funding tied to enforcement, and public delivery of care to effectively improve care for seniors?
The Honourable Minister.
Well, thank you very much, Mr. Speaker. And certainly the Member of Parliament has made an assertion that there's finger pointing. I don't think that's the case at all. As a matter of fact, what I hear from my colleagues at the provincial and territorial level is a willingness to collaborate on how we, first of all, get through this crisis together and strengthen the safety for seniors in homes right now, and then how we look to the future to build a stronger network of long-term care or care alternatives that will ensure that seniors have the right and the ability to live with dignity and safety in their homes.
Mr. Davies.
Well, Mr. Speaker, what I'm not hearing is a single concrete proposal or measure that this minister is suggesting her government can take. But let me move to another subject. Like long-term care, COVID-19 has exposed other major gaps in our healthcare system. Millions of Canadians lost their prescription benefits when they lost their jobs, revealing the fundamental weakness of medical coverage tied to employment status. Will this government finally move to ensure every Canadian gets the medicine they need by bringing in universal public health care, Pharmacare, at its earliest opportunity?
The Honourable Minister.
Well, thank you, Mr. Speaker. And as you know, in the mandate that the Prime Minister gave to me, working on a national Pharmacare plan is still there. I know it feels like a lifetime ago, but the member has very aptly illustrated why affordable medication is so important as part of a robust public healthcare system. And I look forward to continuing our work on ensuring that all Canadians can afford the medication they need.
Nous allons maintenant continuer